Hi everyone, I'm Dr. Stephen Davidson, the Sexual Integrity Coach and the author of Sexual Integrity, Finding the Courage to Be Yourself. It's my intention to bring you sex education topics that you were not allowed to learn about in school, that you won't hear about in church, and probably that Ron DeSantis doesn't want you to know. If you find my videos useful, please subscribe or hit the like button. Also, I always welcome your comments below, and please let me know about other topics that you would like for me to cover related to sexuality and relationships. Today I'm going to talk about the concept of ego-dystonic sexuality. What does that mean? It's a clinical term that's used by sex therapists to reference those sexual desires and activities one might determine to be contrary to their personal values or belief system pertaining to sex, but also for which they have a strong desire and have not successfully resisted. It generally results from sexual shame and a lack of understanding about normal human sexual behavior. Most often, it's associated with cultural expectations about sexuality that have no scientific basis. In 1980, the American Psychiatric Association used the term ego-dystonic homosexuality in their Diagnostic and Statistical Manual of Mental Disorders. A few years earlier, they declared that same-sex attraction was not a mental illness. But there were those who were not able to make peace with their same-sex attraction, and they sought professional help to repress their erotic desires. The diagnosis of ego-dystonic homosexuality was commonly used by therapists practicing conversion or reparative therapies. These are interventions that are increasingly uncommon and considered to be ineffective and unethical by every professional health association. They are now illegal in many states, but they remain legal in the state of Florida. Ego-dystonic homosexuality didn't make it into the DSM-4 because by that time that revision of the manual came out, most therapists used evidence-based interventions and agreed that the right thing to do was to help clients embrace their sexuality, since there was no evidence that sexual orientation could be changed. Same-sex attraction isn't the only aspect of sexuality one might find inconsistent with their beliefs and values. So much of our sexual nature is inconsistent with our social norms and expectations. Religion has groomed us to feel shame about so many of our natural erotic desires. It's one reason why sex education is suppressed in American society. The science of human sexuality is simply inconsistent with the messages we receive from religion and political institutions. Today, you will rarely hear therapists talk about ego-dystonic sexuality. Many young therapists probably have never even heard the term. Most therapists aren't trained in sexology anyway, so they are probably not familiar with the history of how this diagnosis had been used. Still, people seek help for sexual thoughts, desires, and behaviors that they just can't make disappear, even when those thoughts, desires, and behaviors are a normal aspect of human sexuality. When I wrote the book on sexual integrity, I had already spent years working with people who were trying to make peace with their sexual truth. Some of them identified as sex addicts, a diagnosis never recognized by the American Psychiatric Association as a legitimate addictive disorder. This pseudo-diagnosis encompasses all kinds of sexual behaviors that we already understand by another name, and many of which are a normal aspect of human sexual expression. So, what should someone do if they have sexual desires that are not consistent with their beliefs and values? First, examine the belief or value. How did that belief or value come to be established in your life? Is it truly yours, or did you inherit it from someone else? Is it based on fact or myth? What would be the consequences of simply embracing your sexual desires? Are you repressing your sexuality for yourself or someone else? You've heard me say before that there is nothing new in the world of sex. Sexual behaviors we see today, such as masturbation, pornography, kinks, fetishes, variations in gender expression, non-monogamy, opposite sex attraction, same-sex attraction, all of these things have shown up in every culture around the world since the beginning of humanity. Cultures are man-made filters through which we try to control and manage everything, including nature. However, nature doesn't really care about our opinions. Biology will trump our religion and our politics every time. So, humans go on doing what humans have always done and then unkindly judging each other and ourselves. If you're living with sexual thoughts and desires that make you uncomfortable, but for which you cannot seem to overcome, I strongly encourage you to enlist the services of a qualified sex therapist, preferably someone certified by the American Association of Sexuality Educators, Counselors, and Therapists, or someone with a PhD in clinical sexology. Again, I welcome your feedback. I would always love to hear from you. You can leave your comments or questions below, or you can also reach me through my website at sexualintegritycoach.com.